Let's start with kind of a simple question. Can you talk a little bit about what homelessness looks like in our community?
Sure, and that's a great question. There are a lot of stereotypes that come to mind when people think about homelessness. A lot of folks think that homelessness is about mental health and substance abuse, here in Tucson, often equated with older individuals that we see panhandling, maybe on street corners, and often see people as not working and maybe even lazy. And at our family services, that's not how we see homelessness at all. That's not the folks that we're serving who are experiencing homeless. Homeless individuals are hardworking. Being poor is really hard work. And many of the individuals and families that we serve are working. They have jobs, but they're low paying jobs, and don't have benefits. And it's hard for them to be able to make all the needs stretch in order to cover their housing.
Right. I imagine you're seeing that amplified during this health crisis.
Absolutely. We're early in the crisis in many respects as people hunker down. So we're just starting to now see an uptick of people seeking help. And for the clients that we currently serve, starting to need additional services from us as they lose their jobs, as they wait for unemployment to kick in, and unemployment won't cover all of their lost wages, as bills start to mount. As they have their children at home, difficulty with transportation and all those kinds of things. And so we're just going to see this really start kind of upticking now. But we're looking at, this isn't going to be over when we all get to leave our homes. We're talking 3, 6, 9 months, a year, maybe more for many families to get back on their feet.
So, what are your immediate concerns for our community?
Well, our immediate concerns just this week in Arizona, unemployment went up 700% in filing claims, and that's huge. Also, here in Pima County, inmates, nonviolent offenders are going to start being released next week in order to work towards a COVID prevention within the jail system. Those individuals are being released without having a health check or temperatures taken. And so it's possible that that could increase COVID in the community, but also it's going to increase additional individuals as well as families who are going to need services from our sector.
Right.
Those are two of the primary things. And I think it's just, that trickle effect. People over the last couple of weeks have lost their jobs. More people are going to lose their jobs as this continues. And the longer that people are out of work, it's going to be a snowball effect. Also, we're really concerned about what's going to happen when the moratorium of evictions ends in 120 days. That's 4 months of rent that landlords are going to be needing and wanting. And so where's that money going to come from? As well as when unemployment benefits end, when, the shut off of utilities at some point will end, and there'll be mounting utility bills. And so we're really concerned about what's happening immediately, but also, again, really what's going to happen in months to come.
Part of your mission talks about providing stability in times of crisis. How do you think that that's prepared you as an organization for the spread of COVID-19?
I think, we're not unused to crisis. That's what we do. So we help individuals every day with their personal crisis, and we're always looking at how can we help the community when the community is in crisis. And so for us, back in January, when we started hearing the news coming out of China, we were like, this is going to hit the United States. We're such a small world in many respects. And so we started putting our plan together in January to make sure our staff are educated, that we had technology in place. And along, over the years too, we've really worked hard to build a really stable financial base for our organization so we could weather a storm like this and be able to keep our staff employed and to be able to keep offering all the services we need in the community. And that's what we're doing. So all the planning we've done really for years to build up a strong financial base and a strong donor, along with our early planning from back in January, we're seeing, we're nervous, we're anxious like so many others, but we feel that we have a plan in place and it's working.
That's great. Well, I think I speak for all of the community when I say thank you for being proactive and having an eye on this in advance. What can people do right now if they want to help further?
I think there's four things that people can do. One right now is stay home, stay in. We've got to flatten the curve and take this really seriously. Homeless individuals are considered a high risk for COVID. And obviously there's lots of other segments in our population that are at high risk, and we just really need to take it seriously and stay home and do what we can do individually and as families ourselves. The second thing is make a donation if you can, whatever dollar amount that you can. We know the need is going to continue to increase, and we're going to need to increase our local philanthropy in order to be able to help cover the expenses now as well as ongoing. We have a $50,000 match right now at our family due to the generosity of two of our supporters. And so right now is a great time to give. The third thing is get on our website and educate yourself about who we are and what we do. We do periodically put a needs list if somebody wants to donate supplies. That's on our website, but also to learn more about our services. And I think the fourth thing is to be an advocate. Talk to your elected officials at all levels, from the city all the way up through the federal government, and talk about how homeless individuals and people of poverty in our community need their support and need to be considered in all of the pieces of funding and legislation that's happening now and will happen over the next several months. Speak up for women and children, get active, and just stay on top of it as much as you can. But we all need to make sure that our elected officials are hearing from us, thanking them for what they are doing, but also making sure that they don't drop the ball on our most vulnerable citizens in the community.
What advice would you have for someone who's experiencing homelessness right now? If they're experiencing it or maybe somebody's seeing it, what would you advise them to do?
Well, the homeless system is still up and running in our community. It might look a little different. We're doing a lot of it virtually now over the phone, but the system is still there. So seek out a provider such as our family or one of the others and have an intake completed, an assessment done to see what you qualify for. Because we are still all open and we're still open for business, we are still doing assessments and intakes in our programs throughout the community. So reach out for help. Help is still there. And we will do the best that we can do to get you at least some of your needs met. Maybe we can't get all of your needs met. We might not all be able to house you today or tomorrow or next week, but we can maybe help you with some other immediate needs in the meantime. So don't give up and still reach out for help.
Who are your super heroes right now?
Oh my gosh, I have so many. It's like the list is long, so I'll try to be brief. I think two groups of Shiros, I'll put them together in groups to make it easier than calling out anybody individually, is the staff of our family services. I mean, they are doing phenomenal work right now under really, really tough conditions. Our runaway youth shelter is still open. We still have staff who are having face-to-face interactions with people every day. And again, as I mentioned, the homeless population is at great risk for COVID. And so obviously that puts our staff potentially in harm's way, even with all the precautions and safety measures that we put in place. So just hats off to them for putting their work clothes on and actually going to work, as well as the staff who are behind the scenes at home. We have great Shiros and heroes behind the scenes who are doing a great job. And then the other, just hats off to all of the single moms that we serve at our family services who are juggling their children and their children's education and entertainment, plus maybe trying to juggle their own job and struggling with finding childcare to keep working. And then also who are having to deal with the stress of where's our meals going to come from, and how am I going to do that, and where are we headed as a family and as a person. And just hats off to them, because they are just really juggling so much, tangible things as well as the stress. And we just really want to say hang in there, and we've got your back, and we're going to continue to work to support you as much as we can.